Good afternoon. Hope everything is going well. Welcome to week 5, the anatomy of bones and joints. So hopefully at this point you've worked through week 4 and you've looked at some of the basic physiology and kind of cellular structure of the skeletal system, specifically looking at bones. And you've looked at different types of bones and how they've developed at this point as well. And you've looked at the functions of those bone cells like osteoblast, osteoclast, and osteocytes and how they develop. Now you're going to be diving into week 5. Now I'm not sharing my screen on this one. I'm just doing a video because I'm going to show you a few joints. I'm using some models that I have in my office here. But in week 5, you're going to be starting to read through chapter 9 and some of chapter 7 and as well. And you're going to be looking at the axial and appendicular skeletal system. Axial skeletal system refers to your skull and your spinal cord, basically, and your appendicular skeletal system refers to the things that come off of that. So what we're going to focus on in this little video is some of your appendicular skeletal system joints, two of the main ones that you deal with in life and in healthcare. You'll be reading through some chapters, like I said, in the OpenStax books. You'll watch some videos on joints and joint types. I threw a PowerPoint in there as well for those who like the PowerPoints. You'll have a joint anatomy lab activity where you're going to use some diagrams that I've provided, so you won't have to search for any. Sometimes these are hard, so I created some knee and shoulder diagrams for you that you'll be identifying structures on them, labeling them, and then you'll be completing a self-evaluation quiz to make sure you've labeled them correctly. And then you'll be looking at the axial skeletal system before you do a skeletal system lab identification activity, which is basically a quiz. It's not timed and you can use your notes, etc. It's just an activity to go through structural components and different bones. So you'll have to identify different bones and the structures on them. Now when you click on that quiz, there will be a word bank so you can actually take a look at what you need to know ahead of time so that you can organize yourself and you're not just searching for things as you move forward. Okay, so make sure you go into that quiz and take a look at that. I'll try to make another thing in the module as well that has that list, so you don't have to go into the quiz, but it'll be right underneath it. So make sure you look at the list before you do the quiz so you have an idea of what you need to know, and then there'll be images on the quiz for you to answer from. Okay, and none of them, I don't believe, I'll have to go back and look. Most of them are not fill in the blank. They're multiple choice or matching. So, and there'll be letters or numbers on the image. Now, in this unit, you're going to be looking at two different joints. The first one you're going to be looking at is our lovely shoulder joint. Okay, our nice shoulder joint. Now, this would be a right, in anatomical position. This would be my right shoulder. All right. The reason I know that is I can see the indented side of the scapula here. All right, and I know that this piece right here, okay, is the acromion process. And I know the acromion process sits on the posterior side of the scapula. Okay, versus this one right here in the front is the coracoid process, which sits on the anterior side of the scapula. And I also know that this big part here is the medial border. It points to the middle of the body. Okay, and I know it sits in there. And then I know my humerus is on the outside. Now you'll see how well that humerus is stuck in there. You can see the arterial capsule here. Okay, you see these ligaments that hold that humerus into the scapula. Okay, now this humerus, okay, sits in the glenoid cavity. Okay, and I had to hold myself off there from telling a dorky joke because it's named the humerus. So it sits in the glenoid cavity, all right, and it has a labrum in there, all right, that protects the head of the humerus as well and kind of wraps around. Okay, so kind of like a donut, half a donut sitting there for cushion. Okay, so your labrum's in there as well. You have some other parts of this arterial capsule, these glenohumeral ligaments that attach over the head of the humerus to help hold it in there. So now think about this. This thing is fully in, and I can't move it. Think about now on dislocation, when the head of this humerus actually pops out and moves posterior or anterior out of that cavity, and why that's so painful. Think about the ligaments and how they stretch. These ligaments are made of dense regular connective tissue, which is collagen. And so now that ligament is completely stretching or tearing and allowing the bone to pop out of that joint. Okay. Now this is a synovial joint, the humerus into the glenoid cavity. Make sure you figure out what kind of synovial joint it is. Synovial joints have unique characteristics in the sense that they have arterial capsules. They have fluid within that arterial capsule. They have bursas as well that provide they're kind of like a water bed or water bag that provide cushioning. So make sure you look up what type though, because there's all sorts of different types of synovial joints that allow different types of movements. Okay, synovial joints are your most movable form of a joint versus like the sutures of your skull aren't movable, but they're still considered a joint because it's between two bones. But then you also have your vertebrae and your rib cage, which have different synovial joints that maybe are a little more movable, but not as much as this synovial joint. Okay. You also have your clavicle here that's attaching to the acromion process. Okay, so this is your acromioclavicular joint. Okay, AC joint. So when you hear of shoulder separations, you're going to be hearing about it out here. You have these shoulder separations that occur out here by the AC joint. Okay. Make sure you study this joint, do the lab activity, label the items you're supposed to label. Okay, it's going to have you label some things like the acromiocoracoid ligament. I added 3 words into that. It's going to have you label that one. It's going to have you look at the ligament going from your clavicle to the coracoid process, from the clavicle to the acromion process, and some other ones. So make sure you label those properly on your image that I provide in that activity. Okay, very important joint, provides as much movement as you're going to get in the body, which is why it's also one of the most common injured joints on the body, because it has so much flexibility and range of motion. Basically, as you increase the range of motion on a joint, you increase the susceptibility to injury. Okay, so that's your shoulder joint. There's multiple types of joints here. Your main focus is going to be on the AC joint and the glenohumeral joint, which is the head of the humerus into the glenoid fossa or glenoid cavity. Okay, which is, I'm pointing back here. All right, so that's your shoulder. The next one you're going to look at is your lovely knee. Okay, and your knee has multiple joints or articulations, as we might say, between two bones. But let's talk about the main things here. You have your patella that sits on the top, right in here. Okay, all right, and it's a fancy sesamoid bone. It floats basically, but it's embedded within this. It varies in the name. Okay, you have a quadriceps tendon that comes down to here, and then sometimes this one will be called patellar tendon or patellar ligament. It's kind of all one, but you have quadriceps tendon down here to the patellar ligament. Now they say ligament because it goes from patella to the tibia. Sometimes it's also called the patella tendon though, because it's a continuation from the quadriceps. Now the patella sometimes can dislocate or subluxate. A subluxate means it goes back into position, just pops out temporarily, but it can slide out of that groove because these tendons and ligaments get stretched and it pops out. And you'll see this sometimes in athletics or in an injury to someone, and you'll literally see the patella sitting on the side of the leg, just like that. And so they have to deal with that. Sometimes it snaps back in on its own, sometimes it doesn't. Okay, you can see here we have the patellar groove, all right, of the femur. This is the femur. The biggest, strongest bone in the body in terms of size. On the bottom, you have these bumps here. I'm not going to tell you the name of those. You're going to have to look those up right here. That basically are the main part of the articulation with the tibia. Okay, you'll notice the fibula doesn't articulate with the femur. It sits into a little fossa for the fibula on the tibia. Okay. The other thing to remember is the fibula is always on the outside, the lateral side of the leg. The way to remember that is fibula lateral, LA. Fibula lateral, LA. Okay. You can see all these ligaments that are holding the knee together. Okay. And you can see these cruciate ligaments on the inside, the ACL and the PCL, which you will be required to label. And I'm not going to tell you those yet because you can look those up. But you can see you have an ACL and a PCL in here, which is where when you hear about an ACL tear, it's inside here in between the femur and the tibia. And on the side, you have collateral ligaments that help hold everything together and keep it from going too far laterally. The ACL and PCL in the middle keep it going from too far posterior to anterior than it's supposed to. It keeps it from sliding forward too much. Okay. Generally, what happens with an ACL tear is that femur slides forward too far, and that's when you get a tear in your ACL. Okay. And a lot of times that happens on like a stop, when they put a lot of pressure stop, and you get a lot of pull over the top of the knee, and that pushes it forward and pulls it at the same time. One of the ways to decrease problems around ACLs is to have strong hamstrings. And so that's a common area in women athletics, is to really improve hamstring strength to avoid ACL tears. But anytime in sports or athletic type events, you run the risk of injury. Okay, there are things to remember on these bones as well, like tibial tuberosity, which is where you have the tendons and ligaments attaching there. You have epicondyles and condyles on the femur that you'll have to label, but make sure you go through and take a look at the knee. You also notice in the middle of the knee, we have this flat disc-like ligament right here. That's your meniscus, and that acts as a giant cushion and protective in the middle of the knee. Menisci generally wear out over the lifetime, depending on how hard you work your legs, and people oftentimes have to get knee replacements, partly because their meniscus is gone and their femur and their tibia have worn against each other so much that they have to go in and get knee replacements done to protect that joint and allow for long-term function, so that they're not disabled. Okay. Or sedentary, because as you get older, sedentary lifestyle is one of the worst things you can do for your health. All right, so make sure you pay attention to the knee. And again, you have to figure out what kind of synovial joint the knee is. It's a type of synovial joint, and you'll have to do that in the lab activity as well. So welcome to week 5. Dive more into the macro level of bones. You get to learn the different types of bones, the joints. You spent all last week diving into the cells. And then next week, you'll get to kind of wrap it all together and focus on kind of a cumulative understanding of the skeletal system as you head into your end of module assessment on the skeletal system. All right. As usual, let me know if you have questions. Take care and talk soon.